Hello everybody, I am Dr. Raj Kumar Wadhwa. Coming 12th, 28th of July is a World Hepatitis Day. Let us talk a little bit about what is hepatitis and why is it necessary for us to know all about hepatitis. Hepatitis is an infection of the liver caused by a variety of viruses. These are A, B, C, D and E. Of this, A and E is transmitted by contaminated food and water which we eat. They usually cause short-term jaundice and recover without any sequelae. Only a small percentage of these patients develop complications and need hospitalization. However, B and C are not the same. B and C are caused by transmission through infected blood or infected body fluids. A large percentage of these viruses do tend to stay in the blood for a long period of time. Many of these go on to infect your liver, cause damage to the liver at a very low intensity, and over a period of time make an irreparable damage to the liver. The stage of irreparable damage to the liver is called as cirrhosis of liver. How do we get hepatitis B and C? As I said, infected hepatitis B or C blood given to the patient can cause a transmission of this virus, but that has now been a very low source of infection because of the continuous checking of blood transfusion. However, sharing of razors, toothbrushes, having sex with a person who is infected with hepatitis B virus, newborn child who is born to the infected hepatitis B mother can all get these virus infections. In newborn child, 9 out of 10 times when they get infected, they carry this virus to the long term, while in adults, quite a few of them completely recover out of them. 1/3 of these patients who carry the virus on a long term tend to develop cirrhosis of liver, and hence we need to look at it as the scourge which is affecting our society, because India is amongst a nation which has a large percentage of these virus, to the tune of about 4 to 5% of the Indian population is affected by this. How do a common man get affected? Can anybody get infected? Yes, anybody can get infected with this virus. However, there are certain select subgroup of people who are at high risk, either professionally or their behavioral attitude leads them to this group which are at high risk of acquiring virus. These are those infants born to the infected mothers, those having sex with the infected persons, those who are in professions like doctors, nurses, blood transfusion technicians, they handle the blood regularly, those who are inmates of this institutions like jails, and those where there is a crowding and there is a possibility that you may get transmission from one person to another. There is a slightly high risk of transmission in a family where there is an index person with a hepatitis B remains, and those who are abusers like drug abusers, injection drug abusers, all these are at risk of developing hepatitis B virus. You may ask me, how do you identify whether the hepatitis B virus or hepatitis C virus exists in you or not? To be very frank with you, if you look at only clinical symptoms, majority of these people are not aware that they have whether hepatitis B or C virus inside their body, because as I said to them, this is a slow infection persisting for a long period inside the body, hardly affects the system, and God has given us an enormous reserve as far as the liver is concerned. So a part of the liver gets damaged, we continue to function normally. So many of these patients do not have an absolute symptom, any symptoms at all. Some of them do present with jaundice, and some of them do present with the symptoms of end-stage liver disease. That is, this liver disease, when they have reached the stage where it cannot be recovered back to normal, and these include blood vomiting, development of water in the abdomen and thereby swelling of the abdomen, swelling of the feet, altered sensorium, that is patient can start behaving abnormally. All these symptoms are dangerous and they need to be attended to immediately medically. So you need to be aware of that hepatitis B and C can present with any one of these methods. Do we have methods to treat them? Yes, we do have methods to treat them. In fact, hepatitis B treatment is now easily available. It is oral tablets with very minimal side effects. We have to take it for a reasonably long period of time, but then it still controls the virus and can substantially improve the liver disease. So do not get dejected and do not believe the myth that hepatitis B is untreatable. As far as hepatitis C is concerned, the treatment is still available for hepatitis C also. In India, we still are dependent on the conventional mode of treatment of injections. However, recently abroad, the oral tablets of hepatitis C is approved. In India, they are still not available, and even in USA, they are prohibitively costly. Hence, we have to look forward to the many more years further before we can get these tablets to India, and these tablets can reach the common population. Till that time, we have to be dependent on the injections. When the complications occur, you need to treat the complications, like blood vomiting has to be treated by endoscopy. The water collection in the abdomen needs medicines or removal of water through in the hospital. Whenever there is an alteration of sensorium, you need the patient to get hospitalized. When these complications of end-stage liver disease becomes life-threatening, then we have no choice but to do a liver transplantation in these patients. Now, if we don't want this condition to occur or reach this level of liver transplantation, can we do something? Yes, in fact, we can do, what we can do is we can prevent these infections. Hepatitis C virus does not have a vaccine, we cannot give a vaccine to prevent hepatitis C virus, and hence universal precautions are what mandatory for us whenever we are in the hospital or whenever the professionals who are handling the patients needs to be taking care, that they need to wear their gloves, wash their hands, make sure that all the body secretions are treated in a manner that all the hepatitis C virus gets destroyed. Blood needs to be tested, which of course we are doing regularly, and that prevents or reduces the transmission of hepatitis C virus. Injection drug abusers, unprotected sex, all these also can lead to transmission of hepatitis C virus, and we need to be careful when we have these lifestyle habits with us. Hepatitis B virus is preventable. Hepatitis B virus simple vaccine is available, and as of now we have included in our universal immunization schedule, that is all newborns receive the hepatitis B virus. This vaccine is taken usually, there are 3 dosages of vaccine and taken at an interval of 0, 1 and 6 months, and majority of the patients who receive these vaccines get protected with hepatitis B virus. A small percentage of patients who have received vaccine can still receive the virus inside their body. One another question will come to the mind that I have already got exposed to hepatitis B virus or hepatitis C virus. What do I do now? If you have a facility to be knowing what is the status of the patient who has transmitted or who is likely to transmit the virus to you, then well and good. If you don't know the status, then it is worthwhile to take treatment immediately. Contact your doctor as early as possible. He may give you some injections which include immunoglobulin and vaccinate you against hepatitis B virus. However, there doesn't exist a vaccine for hepatitis C virus, but he may give you a treatment which can reduce the chances of your carrying this virus over a long period of time, because the virus detected early, treated early, has a higher chance of recovery. So, on this World Hepatitis Day, be aware of the risks of hepatitis. Make sure that you take due precautions that you don't get it, remain safe, and those who are already infected get well soon with the help of treatment. Thank you so much.